Scott, thanks very much for sitting down with us. I'm excited to ask you all about the science related to psychedelics.
Yes, well, I'm excited to talk about it and I'm excited about the science. So we've come to the right place.
Um, well, yeah, why don't we start with just a quick like 2 minute background on who you are, why you have credibility in talking about this.
I'm a neuroscientist by training. I'm a mouse psychiatrist. I use mice to understand what's wrong in d diseases of mental health, particularly depression.
Cool.
And we use what we learn from our mouse studies to try and develop better therapeutic approaches. One of the most exciting things we've seen coming out of the clinic is the evidence that psychedelics can have beneficial actions in a variety of psychiatric diseases. So my lab took that early evidence to mice, and we have been trying to understand how they work and what mechanisms they're working by.
I wanted to in particular ask about the current trial that you and Dr. Novik are working on at CU, focused on depression and psilocybin. Can you just describe what the experiment is and what you're trying to learn from it?
Yeah, I'm very excited to be part of a clinical trial that we've launched here at CU Anschutz a few months ago, being led by Andy Novik, who is a psychiatrist here in the medical school. And one of the limitations of the clinical studies that have been done to date with psychedelics is that in the end of the day, in order to decide whether it worked or not, all we do is ask people, well, how do you feel now? And so that is obviously the objective. We want people to feel better, but it's a problematic thing to use for a study because it's prey to all kinds of things like expectations. If you are coming into a study and you've been suffering from depression for years and years, and you're all excited about all the things you've read and heard about psychedelics, you bring with you the hope that this is finally the thing that's going to make you feel better. And I don't want to make this at all pejorative, but it's very hard. It's impossible. It's subconscious. You're not consciously changing your answer when we ask you, how do you feel? But you can't help it. You hope you feel better. And so you want to say, I feel better. And our goal here in this trial that Andy's leading is to look at something that's more objective than just how do you feel. And so one of the two symptoms of depression that you need to have in order to be diagnosed with depression is the loss of feelings of pleasure for things that should be pleasurable. A good book, a good movie, time with your family, time with your loved ones. All of these things should bring you a feeling of joy and happiness. And if you are suffering from depression, they don't. And that is the symptom that we call anhedonia. And so Andy's trial recruits patients who have strong anhedonia, and we're hoping we can use that as an endpoint because there are things that we can measure about how people respond to stimuli that should be rewarding, things that should be pleasurable, and we can do that in a way that the subjects aren't consciously aware of how they're responding. And so
Hmm.
we hope that this will provide the first objective endpoint for a psychedelic study that has been given so far. So
So
our study
yeah,
we're using a high dose psilocybin in treatment resistant depression.
so anhedonia, there's a pattern that exists in the brain, and then psilocybin, you're hoping corrects that pattern,
Yeah. So
or
one of
or
the things, yeah, one of the things one of the reasons that I like to study anhedonia in mice, for example, is that we know the brain circuits that are involved in the way people respond to rewarding stimuli. And we can use advanced imaging techniques, MRI, just like you get if you've sprained your knee. We can do that, and we can measure changes in the way the brain responds when we deliver a rewarding stimulus. And what studies have shown is that people with depression don't respond normally, both in a sort of a task that's associated with the imaging, and also their brains at the same time are not responding as robustly as a healthy, not anhedonic person would. And so what we hope to be able to show is that psilocybin will restore both the normal behavior in response to a rewarding stimulus and also the normal brain activity that's underlying and driving that behavioral response.
mm,
You can be subjected to all kinds of influence in how you answer the question, how do I feel? But it's very difficult for you to change your brain activity at will in response to tasks like this.
And what makes you think that psilocybin would actually change this
There is
in
evidence
humans?
that there is some evidence in the form of how do you feel questions where people have asked, how do you feel about a good book, a good movie, a nice glass of wine, a good meal, time with your friends? And as expected, people with depression don't feel much pleasure from those things. But after treatment with psilocybin, they do respond more positively to those kinds of questions. So that kind of evidence is out there. So we're
Mm.
very confident that we'll be able to detect this.
We experience, bliss. We experience mysticism. We experience spirituality, um, oneness, right? Oceanic boundlessness, as they say in the mystical experience questionnaire. And it's that experience, that phenomenology of the medicine that I attribute to feeling amazing after I've taken it in the times I have. But what you're saying is that, like, yes, that might be true as well, but what we're also seeing is fundamental changes in the way that the brain works and the way that the parts of the brain are communicating with each other. So there might actually be a what would you call it, like a neurochemical effect as well as a phenomenological effect of these medicines.
Yeah, this is a really important topic for understanding how these compounds exert their beneficial actions, and a subject of very intensive research at the moment. If I can be allowed to do a little neurobiology 101 here,
I'm
um,
ready.
one of the brain's hormones is called serotonin. Serotonin is the drug that is elevated in with conventional antidepressant medications like Prozac, SSRIs, selective serotonin reuptake inhibitors. They raise the concentration of serotonin in your brain. And serotonin acts on about 13 different receptor proteins. It binds to them and exerts changes in the way cells behave, brain cells behave. Of all those 13 receptors, there's only one that is absolutely necessary for the incredible feelings that you just described, and that is called the 2A receptor.
Mm.
Um, and if you block the 2A receptor, people can take LSD or psilocybin and they don't experience any of those what we call the subjective effects. And so as you mentioned, anybody who's ever taken a psychedelic reports it as one of the most incredible, spiritual, powerful, emotional experiences they've ever had. People will rank it akin to being married and the birth of their children, and that sort of psychological impact and importance in their lives. And that we know again is mediated by the 2A receptor. And because that response is so powerful and has so much of emotional and spiritual components, it has always been assumed that that must be the thing that helps you get over your various mental health challenges that you may be facing. That somehow that feeling of spirituality allows you to appreciate the beauty in life, and that's what makes you get over your depression, for example. But there's been no actual test of that, and so it's hard to know. And again, this is a topic of very strong interest. There are experiments we can do in mice to try to tease that apart. We had some evidence that maybe other receptors are important. For example, we know that SSRIs work to relieve depression. They cause serotonin activation to go up, but they don't cause you to have that same emotional response that a psychedelic experience will give you. So it remains a topic of important study, and we don't know. And there's a lot of efforts going around actually to develop drugs that will produce the benefits, but not produce that strong spiritual emotional effect of the psychedelic journey. And we don't know yet whether those drugs will retain their therapeutic benefits or not. Ultimately, that is the right test. Can you feel a benefit if you don't have the trip? And we
Mm.
don't.
We don't know that.
We don't know that yet.
Because you mentioned if you block that 2A receptor, you won't have the trip, but there hasn't been experiments blocking the 2A receptors in humans and
No,
seeing if they
no,
get better.
no. No, that experiment is going on right now. I expect that in the coming year we will get a result from that study. But at the same time, people are making modified versions of psilocybin that don't produce a trip. They've shown that they can do that, but they haven't yet done the sort of clinical studies that will reveal whether those compounds have therapeutic actions or not.
Mm, yeah.
There's some real, I mean, I don't want to take away from the psychological and emotional and spiritual impact of the psychedelic experience in any way, but there would be some benefits to society if we could come up with compounds that would produce mental health improvements without the trip. Right now, the cost of undergoing psychedelic therapy is a barrier to equitable participation from all groups in society, and also an economic barrier.
Yeah. Well, and beyond the economic barrier, just because, you do a trip and it lasts 6 hours with a facilitator with you, the psychoactive component of these medicines creates the stigma around them. People tripping, and that's the sort of stigma of mushrooms is you trip and you see God, and then you say funny things. But if we remove all of that and just have the therapeutic antidepressive properties of it, then we would essentially, be able to remove that stigma as well. Um,
Yeah, that's
yeah,
correct. Right? You'd be able to pop your pill in the morning and drop your kids off at daycare and then not have to worry about having a trip. And again, that if that works, and it's a big if right now, there would be some benefits to that. And that's not to say again that there aren't other benefits that the psychedelic journey gives you that you might also want to take advantage of as well.
yeah, yeah. So we to summarize, we have shown that there's correlation between having a psychedelic journey and mystical experiences and spiritual experiences and positive outcomes. The causation is very hard to prove. Um,
Exactly.
you're showing with the study that we're doing at CU is we're trying to actually look at the brain mechanics to show a causal relationship between what happens in the brain with someone on a high dose of psilocybin and well, yeah, you're not actually asking them if their anhedonia is cured. You're actually looking at their brain to see if anhedonia is
Exactly
cured.
right. Exactly right.
Yeah, that's amazing.
We'll do both actually, but the two should be
Okay.
correlated. The two should be identical. Although I
when
suppose there could be people that report they feel better, but don't actually show the change in their brain activity. And
mm,
what I would predict is that, over the course of a week or two, the feelings of feeling better would go away in those people
yeah,
compared to those people that showed the change in brain activity to rewarding stimuli.
yeah, it wouldn't be as durable. Um,
Yeah. Yes,
but
exactly.
based on prior studies, we expect it to be durable
Yeah.
because that's
Yeah.
what we've seen
Yeah.
prior.
I guess
Um,
another thing to add to that, if I may, is that it may be that both things are true. It may be
yeah,
that a drug that didn't produce the psychedelic experience could have benefits, but I think it's quite probable that the combination of those benefits with the psychological experience that you undergo in a psychedelic experience, the two add up together, right?
mm,
What would what we've sort of agreed on as a community of neuroscientists is that psychedelics promote plasticity. They promote learning. They promote rewiring of your brain, if you will. They promote the interactions, the restoration of the proper interactions between brain regions, so that people process stimuli, emotional stimuli, physical stimuli, in a more balanced, healthy way. And so the combination of being open, your brain cells being open to learning, essentially learning is plasticity, your brain cells being open to learning and thinking about the things in your life that may be holding you back. The
mm,
combination of thinking about those things at a time when your brain is receptive to that those thoughts and those conclusions that you might reach is a synergistic positive value.
So something you said that made me smirk was just the juxtaposition between a compound that totally blows away our perception of consciousness and delivers these experiences that people can't even describe because we don't have the words for it. Like the comparing that to what you said that they restore the normal brain activities. Like, so you're on one hand, it's like making your brain work as it should. On the other hand, the experience of it in the short term is what you could never describe.
Yeah, yeah. The image that always comes to mind when I think of that conundrum is the Etch-a-Sketch, if you remember that, right? You have a
Mm.
drawing there, and then you shake it up, and then it comes back, and now it's in a new plastic state. You can draw a new drawing in your Etch-a-Sketch and not have to worry about whatever was there beforehand. So, I mean, that's my
Uh,
child's eye view of that
yeah.
phenomenology there.
And the shaking it up is the trip that we can't
Yeah,
describe because we're getting
yeah,
shooken up.
yes,
But then you come back and you're like,
yeah,
I'm fresh.
yeah.
Okay.
You're refreshed,
Um,
exactly. And open
so
to
so
new drawings, right? If you're, grab the wheels and create a brand new drawing for yourself.
yes. Did you go to the American College of Neuropsychopharmacology conference
I
a
did. I
couple
go,
weeks?
yes,
It,
yeah.
it was just like a couple weeks ago,
In
right?
December last month, yes.
Yeah. Um, when we went last year, two conferences ago now, there were lots of talks on psychedelics. Um, what was it like this year? Were they talking about similar things? What was the focus? Like,
Yes,
what's the
yeah.
vibe from this?
Some of the more exciting things in the psychedelic world right now, from an academic, scientific perspective, were again the fact that somebody has created a drug that they think should be much like psilocybin or LSD, but did not produce a trip-like effect in
Mm.
their people that they've given it to. Again, we don't know whether it will have any therapeutic value, but the fact is that they succeeded in making a compound, so that's very exciting.
And they're entering trials to figure out if it has a
Yes, I'm
therapeutic
sure they
effect.
are. Yeah, yeah,
Yeah. And this is I've heard this class of drugs referred to as neuroplastogens. Is that term catching on, or
uh,
is there a different term for this?
yeah. It is. I mean, I think neuroscientists are all a little skeptical about it, right? I mean, the brain is plastic, right? Every time we learn something new, you meet somebody new, you remember their name. That is a form of neuroplasticity in action, right? So we have hundreds or thousands of neuroplastic moments every day.
Ah,
And I think us older folks will tell you young folks that we're not quite as plastic as we used to be, and maybe that's true. Maybe it's just us being curmudgeonly. I don't know, but I think the general consensus is that brain plasticity goes down over adulthood. And is highest early in life when you're learning how to use your arms and legs as an infant. You're learning to
mm,
speak. You're learning who your parents are, all those things, right? You're in an incredible state of plasticity, and it's funny that in the psychedelic space, that a lot of users refer to it as it restored a childlike state to my feelings, right? And
yeah.
I think that there's some. It's kind of ironic or shocking that somebody would recognize both the childlike freedom to enjoy pleasurable things that you experience with psychedelics and the childlike state that maybe it's produced in your brain cells.
Yeah,
Etch a sketch.
that's a great point. So, hot topic in the space around these non psychoactive psychedelic like
Yeah.
compounds. Um, and largely, and we touched on this because doing that would be much more convenient for people than spending a day or a week sitting with a high dose psychedelic experience. Um, another topic in this space that I would love your take on from a scientist perspective is microdosing, because microdosing is also sold to us as you can get some of the benefits potentially, um, but you can take a sub perceptible dose in that you shouldn't actually feel different. It shouldn't alter your consciousness at all, but you might get some of the therapeutic benefits of it. What do you think about microdosing?
Yes, I mean it's again, like you said, a really hot topic. Scientifically, there's been a lot of skepticism. It's been very hard to the standard of proof that we expect as scientists is that if you give somebody a placebo, a sugar pill, that they will not get better. But if you give somebody a microdose, they will get better. And so far, that's been very hard to demonstrate a
Mm,
clear difference. And so again, people are complicated. We bring with us to every encounter with a pill, be it a strong pill or a weak pill, an expectation, a hope, the desire to feel better. And it's very hard to set those things aside and be sure. Um,
mm,
and so there's I'd say there's an increasing amount of scientific studies that have been done. Um, Most with a true microdose, most of them have been mm, in, inconclusive, I would say. So not a clear demonstration of a benefit over a placebo. There's some recent studies that have come out where I wouldn't call it a microdose, maybe what's above a micro, a mini dose, where people are just beginning to sense some perception of the presence of the drug in their body. And under those conditions, people do have been able to show some improvements compared to placebo.
mm.
So it's an open question, and academically and scientifically, I want to know the answer very much. But I think this is one of those things where if it makes you feel better, if you say you feel better, and your interactions with the people you meet every day in life are going better, if you're surmounting obstacles that used to leave you broken and on the floor before, more power to you. Provided microdosing is safe. And as you know, we've done some work in mice that speaks to one of the issues with safety.
Yeah,
Um,
let's dive into that. Because yeah, if as you said, even if it is placebo, um, but people are feeling better, are reporting they feel better, then go for it. Use that
that's
placebo
that's the
if it's
goal, right?
safe. But why would microdosing potentially not be safe?
Well, first of all, if you're using LSD, that's illegal, even in Colorado. So I can't recommend that. If One of the reasons that it might not be safe to microdose also comes from the experience in the 1990s or 1980s when there was a drug that suppressed appetite called fen-phen or fenfluramine. And it was very effective at suppressing appetite, so lots of people took it. And it was discovered that chronic use of fen-phen led to very striking damage to the heart.
Mm,
And subsequent research showed that that heart damage was produced because fenfluramine promoted the activation of one of those 13 serotonin receptors. In this case, the 2B receptor. 2A is
okay.
the trip, 2B is the one that's bad for your heart. And so psilocybin and LSD are very potent activators of the 2B receptor.
Oh,
If you are doing a single high dose psychedelic journey, the chances that you're going to produce damage to your heart from a single day with a facilitator in a healing center are next to zero, I guess. But with microdosing, the chronic consumption over months, weeks, years, that there has been a concern that that degree, even a small degree of activation of those receptors, but maintained over a prolonged period of time, could be damaging to the heart. We don't yet have clinical evidence. Nobody at this point has reported the results of a study in humans using microdosing. But Devin Effinger and Jill King, two postdoctoral students in my laboratory, just completed a study in which we had mice microdosing for a period of 2 months. They were on a 5-day on, 2-day off schedule with a microdose of LSD. They didn't have the mouse equivalent of a psychedelic experience. We know that. So we have confidence that we're inducing, we're giving them a microdose of LSD. And we also gave actually serotonin itself to these mice to produce strong activation of the 2B receptor.
Oh,
And then we
wow.
compared the two groups of mice and looked at heart
Oh, so
functioning.
you had a serotonin group, an LSD group, and then I guess control is just
Yeah,
normal
yeah,
mice.
normal mice. Yeah. Yes. And so we used echocardiography, which is exactly what a doctor would use to examine your heart if there was some reason to think it wasn't functioning properly. And as we expected, the drugs that got serotonin showed evidence of heart enlargement, which is a sign of pathology.
Mm,
But the mice that got LSD at a microdose and a double the microdose, um, neither of them showed any signs of heart damage. And
wow.
so that's, first of all, good news for microdosing. It's an important caveat, though, is to say that absence of evidence is not evidence of absence. And so just because we didn't see any in mice, we can't conclusively conclude that it's safe to microdose in humans. What I would suggest is that if you think you may be at some risk for the health of your heart, you should talk to your doctor about it. You should get yourself examined so that if microdosing starts to produce some bad effects, that your doctor's aware and you have some baseline pre-microdosing uh,
Mm.
data points to compare against, so that if something bad is happening, you can stop immediately.
Yeah, and what kind of damage did fen do, for instance? Like what would we expect to see if it also occurs with these LSD or psilocybin? Is it
The
like heart attacks or yeah?
not heart attacks, but it's a valvular disease. So your heart valves thicken and they're not as flexible as they should be, and so blood flow into and out of the heart is impaired.
Mm.
And so I don't know what the patient would report as symptoms of that. I'm sorry to say, I'm a neuroscientist, not a cardiologist, but
And your
I
mice
sus
aren't reporting
yeah.
symptoms, yeah.
I suspect shortness of breath, tired. It would be kind of like
Yeah.
what's the COPD? It should be like COPD. Yeah.
Mm.
So
Yeah,
shortness of
it's
breath, tiredness, lethargy, not able to produce, run as fast as you would or ski as fast as you would.
and you mentioned that this concern is only really bubbles up with microdosing because with macrodosing, you're not chronically hitting that 2B
Yeah.
receptor. And so, and even with the amount of um, clinical trials out there looking at large doses of psilocybin, we haven't seen any adverse events
No, no,
focused on
and
heart
every
related issues.
yeah, yeah, you're absolutely right. Every one of the academic studies, including ours here at CU Insurance, we monitor cardiovascular function. We look for evidence of strong cardiovascular response during the dosing day, and again, studies have not found any evidence so far. And
Wow.
and that's hundreds and hundreds of patients for single dose high administration, single high administration dosing.
It's fascinating that it's, yeah, in this scenario, taking a small amount of the drug seems like it might be more risky than taking a large amount of the drug. But yeah, the verdict's out still.
Yeah. Yes, that's not the usual way things go.
Yeah, well, and in just going back to the potential efficacy of microdosing, in studies of macro doses of psilocybin, we've seen a dose dependent response, right? And that the bigger doses produce more therapeutic benefit. Is that the case? Or
Um, I think if by bigger you mean compared to a microdose, then yes. There's been about nobody's really done a full dose response curve.
oh,
I think there's sort of two standard doses that people would use as a high dose for psilocybin, 25 milligrams, and then 40 milligrams would be a very high dose.
yeah.
But sort of, 5, 10 micrograms, I don't think people have sort of really explored that.
Mm.
It's
But
it's very expensive to do a full dose response. Um,
uh,
But what people have shown is that there's a correlation between the intensity of the subjective experience using the mystical experience questionnaire, as you mentioned, that people who have a higher response on the mystical experience questionnaire tend to show more therapeutic benefits in a variety of mental health conditions, depression, cigarette smoking, forget what else. Um, but that doesn't mean, well, if I took this dose and it didn't work, I should take a higher dose, or I took this dose and I didn't have a very strong psychedelic experience. That means I won't get better. It's too fuzzy for that
Yeah.
on an individual by individual basis.
Yeah. So, you tend to work in the world of research, why drugs work, how they work, and then that often leads to drugs being developed to based on that research by drug companies taken through the FDA process, getting approved, rigorous testing, all of that. That's the typical way we see these types of medicines get to the world. And there are many programs out there looking at bringing psilocybin or different types of psychedelic compounds through that process. But what we have here in Colorado, and where a lot of our collaboration has been, is on a totally different approach, which is a state saying, you know what, it's okay for people to take psilocybin on their own, so they can personally use psilocybin, and let's also develop a program where we can have licensed professionals administer psilocybin in a controlled setting. Um, I would just like love. I'm just curious on your thoughts of like spending your career working in that world of like drug discovery and development, and then yeah, now seeing the state of Colorado and Oregon before it kind of just open up. Yeah, what are your thoughts and concerns and all of that around this?
Yeah, I think that it's been a really eye-opening experience to see what happened with MDMA for post-traumatic stress disorder last year at the FDA. And what one of the things that I saw and took away from that is that the standard drug approval process that has served us well for decades, the Federal Drug Administration demanding placebo-controlled randomized clinical trials where the only difference is presence or absence of a drug, is not really suited for psychedelic drugs. Again, as we mentioned before, it's essentially impossible to design a study where the subject doesn't realize whether they've been given an inactive sugar pill or a highly psychoactive substance like a psilocybin or an LSD. That you can't blind them in the way that the FDA has demanded from every other study it's ever conducted.
Mhm.
And so that's a problem for the regulatory authorities. I think they are highly conservative, maybe rightly so, but I also feel like they haven't adjusted their stance to take into account the reality of working with substances as unique as psychedelics. Um, Personally, I think that the scientific evidence that was brought to the FDA by the MAPS and Lycos and the people that were behind the MDMA PTSD trials, I think the scientific evidence is overwhelmingly positive. And I think especially, it's not to say that there aren't a few flaws, largely because you can't blind people, also because experience has shown that these drugs work best when combined with some form of psychological support or more in-depth psychotherapy paired with the drug application, which is something that, again, the FDA just isn't built to handle.
Mm.
And so I would like to think that the FDA will get themselves up to speed, that they will take a more holistic view and balance the potential risks with the potential benefits. And I think most of the studies done to date show that the risks are quite manageable, with one exception, which we should come back to. And so I think it is my hope that eventually the FDA will come around. Meanwhile, I think it's very courageous. It's a little bit frightening, frankly, that we here in Colorado and our colleagues in Oregon have voted to bring this process to the fore. Um, I think basically we have volunteered our citizens to be guinea pigs in an experiment. I think the risks are tolerable and manageable, but they're not zero. And so bad things will happen to some people, but a lot of good will happen to a lot of people. And I
Mhm.
think that the state of Colorado, first of all, did a really fantastic job of taking that risk benefit equation into account when they designed the rules for psychotherapy, psychedelic assisted therapy here in Colorado. I'm really proud and impressed with how they've written the rules. Um, for example, the one most serious risk of using psychedelics, in my opinion, and opinion of a lot of psychiatrists, is the risk for developing psychosis or schizophrenic-like symptoms. And we know that a lot of people with psychosis report that their first symptoms coincided with their first use of psychedelic compounds. So that's correlation, not causation, as we've said a couple times already. But it is certainly something to be incredibly careful about. And so for anybody who's thinking of undergoing psychedelic assisted therapy, I would strongly encourage them to talk to their doctor in advance, have a conversation about the mental health history of all your family and your relatives. And if there is any evidence of psychosis or schizophrenia amongst your close relatives, I would strongly discourage somebody from using psychedelics under those conditions.
Mhm.
Certainly, it's something that you would want to enter in very carefully. Make sure your facilitator is well aware of your family history. Start with low doses. Discontinue if things are not going well.
One thing I wanted to just pile on with was, Oregon was certainly courageous in being the first to put this program out there. Colorado is iterating upon that. And one of the ways that Colorado is approaching safety here and mitigating risks in letting the public use psilocybin is this two-tier model of facilitators, the clinical tier and the non-clinical tier for facilitators. And namely that if you have a pre-existing mental health condition, you should be seen by a clinical facilitator who is also licensed in treating that condition. So they'll be able to kind of wear both hats in your facilitation. So they can be a therapist or psychologist at the same time they're being your psychedelic facilitator. In Oregon, that's explicitly not allowed, where you can't wear both hats at the same time. Um, so that it's I'm interested to see how that plays out in our unique landscape here.
Yeah, I'm really proud of my colleagues here at CU Anschutz who push the state very hard on this topic. I think it's really important, and I think we have chosen the right approach. One of the things that we never think about when we talk about the brain being neuroplastic is that that can go for good or bad. If you are the victim of some traumatic event, sexual assault, abuse, beating, something you've witnessed, the bringing those events back to the fore, paying attention to them, having them in your mind, um, has the possibility in a plastic state of actually reinforcing them, not just erasing them. And so again, we shake up the Etch-a-Sketch, but what we draw afterwards isn't necessarily a happy smiley face. It could just as easily be some frightening, scary monster that we draw with the Etch-a-Sketch. And so the point of having these the facilitators with clinical experiences, they know how to walk somebody through that dangerous minefield of reliving some traumatic event from earlier in their life. They can help
Mm.
you, guide you around the mines, and get you safely to the other side. And that is a skill. That is something that we train people to do. That is something that people work very hard to learn how to do. It is not easy.
Yeah, that's a great point. And certainly things that facilitators, we work with facilitators in Oregon who have seen those sorts of situations. And yeah, I think those can be the scariest types of journeys is when someone actually goes back and
Yeah.
revisits something
Yeah.
horrible.
Yeah. It's a very, it takes incredible skill on the part of the facilitator. Most of us would say that confronting those dragons is part of what allows you to move forward in a way that leaves you in a better state than you started. And so I think that every facilitator that I'm aware of thinks that facing a challenging experience, it leads to strong benefits on the other side. But the line between challenging and damaging is very narrow and difficult to see. And if you are considering a psychedelic journey, I think it's really important to find a facilitator who has a lot of experience, and having a conversation with them about what you hope to gain from your journey and what their experience level is, with that sort of an ask.
Mm, gotcha. Well, Scott, we hit on a bunch of topics today, and I so appreciate your time. I want to let you get back to your lab there at the Department of Psychiatry at CU Anschutz. Um, but yeah, thank you so much for taking the time to share.
Yeah, thank you, Niko, and thank you for all the things that Althea is doing to help make this process a success here in Colorado.
Awesome. Cool. Cut.
Cut.
Um,